So this is an arthroscopic picture, an arthroscopic video clip. And we're in the scope, the fiber optic camera is placed looking directly at that spot underneath the kneecap like we just mentioned. So we'll play this video so you can sort of see. This is a knot tie. This is like the tip of my finger, but inside the joint through a small incision. And this suture is about 3 or 4 times the size of a typical thread on a sweater or a shirt. So it's not much. It's not nearly as big as it looks. I know my patients tell me it looks like a huge cord. But as you see, I'm using my finger and I'm cinching down that ligament in this location here. And you can see we've made one suture throw here, and now my finger, now I got another one in there, so we're going to tighten that structure down. And as we tie the knots in there, my goal would be to make a whole region along the side of the kneecap. The kneecap is up here. You can't quite see it in this view yet. We'll show that in a minute. But we'll make a pleat of tissue right here that's going to tighten that ligament that we were just talking about arthroscopically. So this is an example of what the suture hook looks like, where I put these sutures through. And then once we're done with the procedure, what I do is I bring the patient through a range of motion. We're seeing the patella up above. The reason that's all the movement is that I'm bending the knee back and forth to watch to make sure that the patella is tracking right in the groove that it's supposed to. In the background, we see my layer of sutures that are all back here. And once again, we watch the knee go back and forth into flexion and extension, bending it and straightening it to make sure the kneecap goes right into the groove where it's supposed to.